Good afternoon and welcome to Chapter 2, Workforce Wellness and Safety. We're going to cover a lot of things in this chapter, especially how to take care of each other and ourselves as responders in the emergency medical services field. You know, in this particular field, you're going to be exposed to a variety of different types of situations in which your safety could very well be jeopardized. So therefore, you need to know some of the ins and outs and some of the things that we need to do to take care of ourselves, not only on the job, but also after the job is done as well, how to keep ourselves in good fitness. So to take care of others, we got to be able to take care of ourselves. Bottom line, your EMT training includes recognition of hazards to your health, safety, and well-being, to include personal neglect, environmental and human-made threats, and also mental and physical stresses. Wellness goes way beyond the prevention of diseases. It is a state of complete mental and physical and social well-being. As a healthcare provider, you should be a model of life and health and wellness. So therefore, your patients see that you're healthy, you're into what you're doing, your fellow peers, your supervisors, everyone around you can see that you're a model of that kind of health and state of well-being. A state of wellness must occur at work for protection from communicable diseases and also seen hazards, and at home, a healthy diet, exercise, getting enough sleep, refraining from the use of tobacco, drugs, and excessive alcohol, and taking some time to relax. EMTs are often called upon to work in circumstances that result in both acute and cumulative stress. As an EMT, your role is to be prepared, anticipate needed resources, control the scene, and care for your patients. In a calm manner is how you need to be able to respond to these particular situations. You got to be calm and when you approach the scene, so it'll help calm the patient, family members, and also bystanders. Wellness and stress management is a part of that. First off, prolonged physical stress can drain the body of all of its reserves. Everything that you may have, your sugar reserves, your energy, it just drains all that life right out of you. So it can deplete those key nutrients and make you weak and more susceptible to illness. So understanding how stress affects you physiologically, physically, and psychological can help you control your reactions and minimize the effect of stressors. Regardless how stressful the situation, you must focus on the following in this order. Number 1, personal safety. Scene safety, to include safety of others and also patient care. Stress management refers to the tactics that have been shown to alleviate or eliminate stress reactions. They may involve changing a few of your habits, changing your attitude, and also your perseverances. So, strategies to manage stress are up here on the following. Minimize or eliminate stresses as much as possible. Change partners to avoid negative or hostile personalities. Change work hours, change work environment, cut back on the overtime. Change your attitude about the stressors in general, and then talk about your feelings with people that you trust. You also can help seek out professional counseling if needed. Do not obsess over frustrating situations that you're unable to change, such as relapsing alcoholics and nursing home transfers. Focus on delivering high quality care to your patients. Try to adopt a relaxed, philosophical kind of outlook. Expand your social support system beyond your coworkers. Develop friends and interests outside of emergency services. And also you can minimize the physical responses to stress by using various techniques, such as periodic stretching or yoga, slow deep breathing, regular physical exercise, at least 150 minutes per week, including cardiovascular, progressive muscle relaxation, meditation, and limiting your intake of caffeine, alcohol, and tobacco use. Also, your nutrition is very important. If you don't have a nutritious type of diet, your body's going to suffer. Your body's 3 sources of fuel are carbohydrates, fats, and proteins. They're all consumed to increase quantities during stress, particularly if physical activity is involved. To perform efficiently, you must eat nutritious food. Food is the fuel that makes the body run. Limit your consumption of sugars, fats, sodium, and alcohol. Complex carbohydrates rank next to simple sugars in their ability to produce energy. Complex carbohydrates are such as pasta, rice, vegetables. They're among the most reliable sources of long-term energy production. This doesn't mean you have to eat it all the time, because if you eat it all the time, you may tend to gain more weight than you wish to. But when you know you got to go to work, eat you a nice bowl of pasta the night before, or that morning have some rice with breakfast or something along those lines, so that you're getting those long chain carbs into your body. Fats are easily converted into energy, but eating too much fat can lead to obesity, cardiac disease, and other long-term health problems. Exercise and relaxation. Regular exercise will enhance the benefit of maintaining good nutrition and also adequate hydration. When you're in good physical condition, you can handle stress more easily. Also, when you exercise will help you maintain the strength to lift patients as well. Infectious and communicable diseases. You can get exposed to this kind of stuff in this job. An infectious disease is caused by harmful organisms within the body. A communicable disease can be spread from person to person or from one species to another. Infection risk can be minimized by having immunizations, protective techniques, and hand washing. This is one of the reasons why in your entry into the EMT program, we have to find out what your immunization status is, because if you are not immunized, then you have a high risk of being infected by patients who may carry things that you can have an immunization for. When these protective measures are used, the healthcare provider's risk of contracting serious disease is very negligible. Routes of transmission. Transmission is the way infectious diseases are spread. You have direct contact, which is an example of bloodborne pathogens in which blood transfers from someone else directly into your blood. You have indirect contact, which are needle sticks. This is a pathogen that is exposed to you through a needle stick. There's blood inside the needle, and it goes directly through the needle into your skin versus, somebody's blood mixing with an open cut for yours, which is your bloodborne or direct. Then you have airborne transmission, which is a sneezing, coughing. They have the person or patient has now put those droplets of infectious pathogens into the air by either sneezing or coughing. Then you can also get foodborne transmission from contaminated food, and also vector-borne transmission, which comes from fleas and ticks. All right, risk reduction and prevention for infectious and communicable diseases for the EMT. All EMTs are trained in handling bloodborne and other bodily fluid type of pathogens. The CDC has developed standard precautions concerning personal protective equipment that we wear, the patient care environment that we work in, and also special circumstances. Proper hygiene. This is the simplest thing, yet most effective way to control disease spread or disease communication, if you will just simply wash your hands. And I'm talking about washing your hands for a period of time that's going to be appropriate. At least, you should sing the song, Mary Had a Little Lamb, or Row, Row, Row Your Boat 3 times while you're washing your hand. And the more friction, the better, because you're actually cleaning and opening and getting rid of dead cells that are on your skin or on your hands. So wash your hands before and after patient contact, even if you wear gloves. If there's no running water, use some kind of waterless hand washing substitute, which are usually alcohol based in nature. Gloves, wear gloves if there's any possibility for exposure to blood or bodily fluids. Vinyl, nitrile, and latex gloves are effective protection. Wear heavy duty gloves when cleaning the ambulance. And also change gloves in between patients. Don't ever want to bring some patient's blood on a pair of gloves to another patient. That's why we usually put 3 pairs of gloves on when we're going to a trauma call, so we can just peel one off and use clean gloves on the new patient. Alright, so removing gloves requires a special technique to avoid contaminating yourself with the materials on the outside of the gloves. We're going to do that in skill drill 2-1. Eye protection and face shields. Eye protection protects the blood from splatters. Prescription glasses are not adequate because they need to cover the sides as well as the front. Goggles or face shields are the best type of eye protection we can use, such as you see on this particular photograph. Gowns. A gown provides protection from extensive blood splatter. A gown may not be practical in most of the situations that we deal with. It may even pose a risk of injury, but I can give you an example where a gown is very appropriate in delivering a baby. Inside of the OB kit or obstetrical kit prior to delivering the baby, you'll put that gown on to help from getting those materials all over you and your uniform. Mask, respirators, or barrier devices. Wear standard surgical mask for fluid splatter. Place a surgical mask on the patient when there's a communicable disease, especially a potential airborne disease like tuberculosis. Use a mask with a particulate air respirator on yourself if the disease is tuberculosis. This particular mask that you see here is a high efficiency or a HEPA filter mask. When performing artificial resuscitation, use a pocket mask or a bag valve mask. With an infected patient, use a pocket mask or a bag valve mask combination. Dispose of these devices according to your local guidelines. Proper disposal of sharps. One of the things that I want you to remember, don't ever hand a sharp to somebody else to put it in the sharp container. Allow them to pass the sharps container to you and you put it in the container. And don't ever accept a sharps from somebody else to you. Don't let somebody pass you a sharps. Again, put the container in front of them and allow them to drop it like you see in this particular photograph on slide 17. Do not recap, break, or bend needles. Dispose of used sharps items in an approved, closed, rigid container. There are some employer responsibilities when it comes to infection control. The risk of being exposed to communicable disease is a hazard of your new job. Follow OSHA guidelines or other national guidelines and standards to reduce your risk of exposure to bloodborne pathogens and airborne diseases. Not only will you get the education portion of the infection control standards from us, but you'll also get it when you go to work for somebody, because everybody's got to have an infectious exposure plan. Know your department's infection control plan. So when you go to work, you need to be asking about that, which in most cases, I'd say 90% of the time, 99% of the time, you're going to have that education before you get started working. All right, so establishing an infection control routine. Infection control should be an important part of your daily routine. Components of an infection control plan are as follows: determination of the exposure risk, education and training, personal protective equipment or PPEs, cleaning and disinfection practices, tuberculin skin testing and fit testing, post-exposure management, compliance monitoring, and also record keeping. Each one of these components you will find in an infection control plan once you start working for an agency when you become an EMT. Follow the skill steps in skill drill 2-2 to manage a potential exposure situation. So we'll be doing that skill drill later on in your program. Cleaning is an essential part of the prevention and control of communicable diseases. This ensures the removal of surface organisms, so we be sure that we have all of the organisms removed from the potentiality of being exposed to it. So also, you need to make sure you're cleaning the ambulance after every single run. That's very, very important, because if you're not doing that, there could be a potentiality of being exposed to something left in the ambulance. A good example of that is a drop of blood. Hepatitis C, the virus hepatitis C, can live outside of the body in a drop of blood for up to 2 weeks. All right, so immunity. Talk a little bit about that. This is slide 20. Even if germs reach you, you're not necessarily at risk for infection. Immunity is a major factor in determining which host will become ill from which germs. You may be immune or resistant to particular germs. Characteristics of immunity: you've been immunized or vaccinated. You're able to recover from an infection from that of a germ. Preventative measures is to maintain your personal health. Annual health examinations should be required for all EMS personnel, and get immunized. Make sure you keep your immunization records up to date. That's one of the biggest things that we find with students that are coming into our classroom. Your immunization records are very lacking. It is important. You may not think it's important today, but every time you move to a job, that's one of the things they're going to ask you about. Anytime you go out of the country, it's what they're going to ask you about. And if you don't have proof that you have at least hepatitis B vaccine, maybe even hep C vaccines nowadays, which I think got pulled off the market recently. But anyhow, something as simple as measles, mumps, and rubella, or the MMR, if you don't have proof of that, you may not be able to get into another country. So anyhow, these immunization records are very, very important. Make sure you keep up with that. Now, general post-exposure management. So you think you've been exposed, you got stuck by a needle or some blood splashed in your face, maybe in your eyes, in your nose, mouth, that kind of thing. If you are exposed to a patient's blood or bodily fluids, first thing you need to do is turn over patient care to another EMS provider. Clean the exposed area with soap and water. If your eyes were exposed, rinse your eyes for about 20 minutes. Activate your department's infection control plan and seek your supervisor out immediately. You will have to complete an exposure report. Time is important. Some infectious agents act quickly and others may go dormant. Now, one of the things that there is some prophylactic treatment that can be done at the hospital for certain disease processes. Your supervisor will help manage that for you. So early activation of a plan is very, very critical. Once something happens, you need to let somebody know and get the proper reports filled out. All right, scene safety. At the beginning of almost every slide that you see from here on out, scene safety is going to be one of the number one slides, or the number one slide that you're going to see. We reinforce this in every single chapter because we don't want you to get hurt. You need to make sure the scene is safe before you enter it. So there's several things that we need to talk about. The personal safety of all those involved in an emergency situation is very important. Begin by protecting yourself as soon as you are dispatched. Put on your seat belts. Make sure you get your personal protective equipment, especially your eyewear. I always keep my eyewear hanging around my neck. If I get out of the ambulance, I put it onto the mirror or onto the dash, so when I get back into the aircraft, yeah, I'm a flight medic, when I get back into the aircraft, it's sitting right there ready for me. All I have to do is just slip it around my neck and then put my helmet on and off we go. Continue to protect yourself once you are on the scene. Make sure the scene is well marked. Place warning devices to alert other motorists to the scenes. Mark a safe distance. Park at a safe distance away from the scene itself. Make sure that there's plenty of light if it's dark. And make sure you're wearing reflective clothing, daytime or nighttime. Put on that orange vest. This way they can see you. If you cannot be seen, drivers can't see you, you're going to get run over. So be sure that you're very, very bright and reflective. So continue on. Some of the things about scene safety, some of the things we need to look for is scene hazards, especially hazardous materials to begin with. Upon arrival, look at the scene and try to read any labels, placards, or identification number from a distance, perhaps using binoculars if you have them in your ambulance. A specifically trained and equipped hazardous materials team can handle these kind of situations, but you need to notify them that you have this kind of situation. If you're driving up to a scene and you're looking through the windshield and everybody's laying on the ground, including maybe a police officer, or maybe it looks like some bystanders got out of their car and they fell to the ground, and there's a truck that maybe or maybe not there's fumes coming out of it, or green colored gas or gray colored smoke or whatever, don't go near that scene. Something's being emitted out of the scene that's killing people. If you go in there, then you're going to be taken out as well. You should not begin caring for patients until they have been moved away from the scene and decontaminated, or the scene is safe for you to enter. Do not enter the scene unless it's safe to do so, period. Electricity. Many providers have been killed because of down power lines. They get so focused on the event itself that they'll get out, they'll run up onto the scene, and they didn't see the electricity or the power line that was down. And that leaking antifreeze is all over the road. It is electrified. Once you go across of it, and first time you ground yourself to it, when you kneel down and by chance touch that wet antifreeze, you're going to be electrocuted. So please make sure that you mark all this up. Mark it as hazard. Make sure you call the power company or call dispatch, and they will be en route to manage your electrical situation. Other thing too is lightning is also a threat. So if you have lightning, be conscious of that. Be conscious enough that it's time not to play around on scene with patients, but get them off the scene and in your ambulance ASAP, in order not to be a threat out there, a lightning rod as we call it out there, hanging out waiting to get struck by electricity when you're trying to get somebody out of a car. Protective clothing, as you can see here, this is turnout gear. This is like a firefighter wears. He's got his helmet on, he's got his turnout gear, and he's got his gloves. Protective clothing that you're going to be putting on is dependent on the situation. Wearing protective clothing and other appropriate gear is very critical to your personal safety. So become familiar with whatever protective equipment you're going to be utilizing or that's going to be available to you by your department. Inspect it, and look at your clothing and gear, quite often, making sure that it's good. There's several different types. You have cold weather clothing, turnout gear, gloves, helmets, all kinds of different types of equipment that you're going to wear. And, you would definitely need to become familiar with what you're going to be using. Caring for critically ill and injured patients, the patient needs to know who you are and what you're doing. One of the first things that I always say to my students is that, you need to introduce yourself. If you came walking up to me and I'm bleeding, my guts are hanging out and all that kind of stuff, am I going to be absolutely cared what your name is or whatever? Probably not. But if I'm conscious, alert, I'm oriented to the person, place, and time, and you come walking up to me and you start grabbing me, I'm liable to belt you. Don't put your hands on me unless you introduce yourself and talk to me and make sure that you have permission to treat me, because that is battery. And we will talk about that in the legal implications portion of this program. The patient needs to know who you are. Let the patient know who you are, what certification level are, and address their immediate needs. Avoid making any unprofessional comments during your care to a patient, or especially during resuscitation. Treat all patients with dignity and respect. Treat somebody like you would expect to be treated. Responses of the critical patient, they can be anxiety, pain and fear, anger, hostility, depression, dependency, guilt, mental health problems, or they may have a hard time, problems or receiving bad news, because you're going to be telling them something is going on, something's happening. You're never going to lie to your patient. You may end up on a situation where you're having to tell a parent or parents that their child has died. Then they become patients. So you're going to have to know the ins and outs of being able to do that and how to manage that. All right, so techniques for communicating with critical patients. Avoid sad, grim comments, the doom and gloom stuff. Remarks about the patient's condition may increase their anxiety or compromise their recovery. Orientate the patient to his or her surroundings, because remember, this is new. They've been ejected out of a car, or they're still in the car. Now you're moving them out of the car, putting them in the ambulance, those kind of things. Keep them informed. Be honest and communicate with them. Don't sit there and talk all this medical jargon and all this kind of stuff and not communicate with your patient. Your patient's going to be lost. They're going to be scared. Decide how much information the patient can understand and accept. Allow the patient to be a part of the care that's being given. And allow for hope. Don't say, oh, yeah, man, you're really hurt bad. I don't know if you're going to make it or not. Don't say that kind of thing. That's horrible. If there's the slightest chance of hope remaining, transmit that message to the patient. Sometimes patients absolutely know they're dying. We had a student that happened to be on a shooting call a few semesters ago, and the gentleman was shot 9 times. 9 times. He was breathing his last few breaths, but he was still conscious. He had lost all of his blood. He was in the process of dying when this student got there as a part of the ambulance crew that was responding to the call. She watched him die, and she talked to him during his dying process. And basically all he really wanted is to know that she would relay the information to his family that he loved them. And that was it. And then he passed away. But there was nothing that could be done. There was multiple shooting victims on the scene. But that was this one thing that this student experienced. That's big time stuff. That really is. That's big time stuff. So, take the information, do what you need to do with it. And of course, we're going to talk a little bit about PTSD a little bit later on and managing those type of problems. But you'll need to communicate those kind of things with us and with other supervisors that you'll be working with. All right, so locate and notify family members. Assure the patient that you'll take care of notifying the appropriate people, and make sure you do so. Always follow through with your promises. Injured and critically ill children. This is one of the most difficult calls that you'll end up running. Children are very tough. It's fortunate that we don't have a lot of these. We're talking about on an average, 5% of your calls throughout a year, maybe a little higher depending on what kind of system that you work in, will be a child. Children are usually pretty resilient. They bounce back and go home, or they are not injured so badly that they can't go to the hospital with their parent. Most of the times when we get involved in are automobile accidents in which it's a horrific accident and they weren't wearing seat belts and were ejected, or they were and they're just hurt inside the car. Children should be cared for as any adult would be. It is important that a family member or responsible adult accompany the child to relieve anxiety and assist in care as appropriate. Dealing with the death of a child. The death of a child is a tragic and dreaded event. There's no good come out of it. All the children that's ever died within my care or care that I was exposed to working in the hospital, there is no good. It's not a positive thing at all, and it's a very difficult thing to manage sometimes. So you need to help the family through the initial period. That's going to be your number one priority. There are times in which the child is just, obviously there are injuries that are incompatible with life, and there's nothing you can do about it. Helping the family acknowledge the death in a private place, as private as it can be. Understand that shock will be a part of this process. It's a part of that grieving process. There'll also be denial and disbelief. They're very, very common emotional reactions to the death of a child. Do remember, too, that culturally people grieve in different ways. You may have silent grievers, you may have very loud and boisterous grievers. So you need to understand that these things do happen and be prepared for that when it does happen. As circumstances allow, let the parents hold the child. Use your best judgment and determine if this is appropriate or not. Let the family's actions be your guide. The family may want to see the child, and you should allow them to do so. Prepare the parents for what they will see, and cover up any really bad injuries that would be burned into their memory for a very long period of time. And we can discuss more of this on an individual basis during our discussion groups. Death and dying, it does happen. Death may occur quite suddenly or after prolonged term illnesses. The EMT will sometimes face death. It's just the way it goes. You're in this business, it's what's going to happen. So you have 5 different components of the grieving process. First one is denial, next one's anger or even hostility, then bargaining, depression, and acceptance. What can the EMT do? Ask the patient and the family if there's anything you can do to help, because the patient, when we're talking about a dying patient, we're talking about possibly a patient who's a hospice patient that has a terminal illness, or you're transporting, going back home from the hospital because there's nothing left that the hospital can do. Patient's conscious, patient's alert, but they're dying from cancer or some kind of debilitating disease. Reinforce the reality of the situation with both the patient and also the family. Be honest and sincere. Do not say you know how the patient or family feels, because you do not. You absolutely do not. That's one of those biggest faux pas that will take you down the wrong path every single time. Let the patient or family members grieve in their own way after the death. This table on this slide lists statements to use when responding to grief. This is table 2.7 in your book, and it's slide number 31. Stress management on the job. Now we're talking about working for you, thinking about your brain and what you can do about managing stress. This job, EMS, is a very high-stress job. It is important to know the causes and how to deal with the stress. A general adaptation syndrome is the alarm response to stress, reaction resistance to stress, recovery, or also exhaustion from stress. Physiological manifestations of stress, they're all listed on here: increased heart rate, increased blood vessels, blood pressure, dilated venous vessels near the skin surface, which cause cool and clammy skin, dilated pupils, tensed up muscles, increased blood glucose levels, perspiration, also decreased blood flow to the gastrointestinal tract. Situations that become, stressful to EMS providers, specific situations, dangerous situations where you get involved, where maybe there was a fight or maybe there was a shooting that broke out while you're still on scene, physical or physiological demands, critically ill or injured patients, dead and dying patients, overpowering sights, smells, and sounds that you'll never forget, multiple patient situations, angry or upset patients, family and bystanders. A lot of people can't deal with conflict management. There's a way to deal with it, and there's a way not to deal with it. And some of the things that to deal with it we'll be sure to teach you guys once we get into that part. That particular chapter is covered under psychological incidents or psychological emergencies. Unpredictable and the demands of EMS, because EMS is very unpredictable. A lot of it's go with the flow or fly by the seat of your pants. Absolutely, a lot of the situations out there. So, stress reactions, you have acute, delayed, and cumulative. Make note of this. You will see this not only on your Quizlets, but you're also going to see this on your exam. Acute stress reaction. These occur during the stressful situation. They occur at the time. Acute means a sudden onset of something. So an acute stress reaction is happening at the time. Delayed stress reaction. This manifests itself after the stressful event's over. So you've finished the call, you've left the scene, and this happens later down the road. And then a cumulative stress reaction. This is prolonged or excessive stress. This is stuff that's been building up, building up, building up. Hence worth the word cumulative. So the word cumulative is going to cue you in on this particular answer. All right, so PTSD, post-traumatic stress disorder. We have recognized this for quite some time. We actually started looking at it back in World War I, as early as World War I, and giving it a label and trying to treat soldiers that were in shock after seeing so much horrific injuries and battle wounds, and also battle noises and smells. Some of the explosions that were related to large artillery guns caused what they termed as shell shock back in that time. Anyhow, PTSD can develop. Is characterized by re-experiencing the event and over-responding to the stimuli that recall the event. Critical incident stress management was developed to decrease the likelihood of PTSD. CISM, or critical incident stress management, is what I just said. It's a program. It's a program that identifies calls that are really stressful, like that shooting I was telling you about earlier. We did a CISM program for that particular student to make sure that she could relatively understand the event that she went through and how to cope with some of the memories of what she saw, because it's very blatant. The smell of blood, the face of death. I mean, these are very real things. CISM is used to help providers relieve stress and can occur formally. It's trained CISM type of preceptor or professionals come in and facilitate a meeting. It's a diffusing type of session. They're used in conjunction right after the call to diffuse some of the instant anxiety that goes along with what happened at the event. Then there's debriefing sessions that are held anywhere between 24 to 72 hours after the incident. If CISM is not an option, private counseling by a mental health professional, or maybe even by your pastor, would be more preferable. Don't just bottle that stuff up. It's not good for you. All right, so this slide, which is table 2.8, it shows the warning signs of stress. You can read that on your own. It's slide 37. It's also in the book. Stressful situations, many situations are stressful, and you know, there's a lot more than just involved. Exercise extreme care in your words and actions when you're in the middle of that stressful event. Bring a sense of order and stability to the terrifying chaos that the patient is experiencing. Because let me tell you something, there are times that it is very much so a chaotic event. The calmer you are, the better you can bring the event, or the quicker you can bring the event to a more stable event. Will there be still some chaos for the patient? Of course there will be. But the calmer that you can portray yourself as, the better off your patient's going to be. Give the patients the opportunity to express their fears and concerns. Let them open up. You are a listener at that point, a listener and a lifesaver. An L&L, listener and a lifesaver. This is what you're doing. It is usually best to manage these in a very calm manner, in a listening type of manner. Don't add feedback where it's not needed, and make sure that you open up to that patient. Let this patient, open up to you, should I say. It is usually best, especially if this is a child type event, to allow the parent to go with you. The only time that we don't do that is if the child's unconscious, unresponsive, and they're in a critical situation where we may be doing CPR, we're working very hard to save the child's life. Otherwise, it's much better if your patient's conscious and alert, and a child, have the parents go in with. They need to fill out consent paperwork. All right, so violent situations, potentially violent situations, civil disturbances, large gatherings with potentially hostile people, domestic disputes, and crime scenes. When multiple agencies respond, it is important to know who's in command and who's going to be issuing the orders. You and your partner must be protected from the dangers at the scene to be able to provide care. Usually there is a place that you're responding to that's a secured area. It's a standby area. It's staging is what they call it, staging area. But until the event is safe, and then you'll move in. Usually police department will get there first, fire department follows. It is called scene is safe, and then you go in. If you're on an ambulance, if you're in the fire department service, then you'll probably be the second or first in. Do not disturb crime scene if there is a crime scene, and there's a whole section on that at the end of the program. There's a whole chapter on crime scene management that we're going to talk about. All right, so behavioral emergencies. These are emergencies that do not have any clear physical injury or physical cause. It's just somebody who has some kind of psychological emergency. And again, there is a section on that as well. The cause may turn out to be a physical, though. It could be hypoglycemia or head trauma, hypoxic, or some kind of toxic ingestion of drugs or some kind of chemicals. These emergencies result in an aberrant behavior by the patient that you just don't know what's going on. So you got to do the best you can to protect yourself and protect them as well. Most behavioral emergencies do not pose a threat, but some do, and you must use caution in these kind of cases. Workplace issues, a few things to talk about, cultural diversity and also sexual harassment. Cultural diversity on the job, each individual is different, folks. Recognize that, whether it's a co-worker, whether it's a supervisor or some leadership management, or if it's your patient or a patient's family member, there are cultural differences. Communicate with each other in a very respectful way. You need to make sure to do that every day. Yes, sir. No, sir. Yes, ma'am. No, ma'am. Open doors for people. Folks, if we did more of this in our own general society, we'd be better off as a society as a whole. Understand how to communicate effectively with coworkers from various backgrounds. Avoid sexual harassment. It's going to lead to nothing. You're going to end up getting in trouble over it. There's two types of sexual harassment. First one that we'll talk about is quid pro quo. This is when the harasser requests sexual favors in exchange for something else, such as a promotion. Then you have hostile work environment. Jokes, touching, leering, requests for a date, talking about body parts. All these things are very inappropriate. It's going to do nothing but lead down the path of you losing your job and perhaps your license. So just don't do it. The intent of the harasser does not matter, but rather the perception and the act and the impact that the behavior is, has on someone else, period. Because you guys are in the public eye and your representation of public service, you've got to be better than the average Joe or average Joanne, period. You've got to present yourself in the most professional way in order to come across as respectful. All right, other workplace instances, substance abuse. It increases the risk of accidents and tension, causes poor treatment decisions. Also, you need to seek help or find a way to confront an addicted coworker if you have that kind of situation, especially with your partner. Allowing it to go on poses a tremendous hazard to you and to the public. Employee assistance programs, which are called EAPs, are often very helpful and available. Suicide prevention, a combination of cumulative stress and acute intense stress can weigh heavily on EMS providers. We just talked about that. We are in a high stress environment. There have been many healthcare workers, doctors, nurses, EMTs, and paramedics that have taken their own life because of the stresses. And they've just elected not to discuss those stresses with other people. Injury and illness prevention, anything and everything you can do to prevent yourself from being hurt, you got to do that, because if you end up getting hurt, you're not going to help anybody. You're not going to be able to provide assistance when it's needed. And as far as prevention, wellness prevention, exercise, have a good diet, have a good outlook. And when you're off the job, relax. Don't go out with a bunch of your EMS friends and go get drunk or do anything like that, or go out and party and stuff. You need relaxation time, good time. Find your favorite hobby, whether it's fishing, whether it's sewing or knitting or just hiking, going out for a walk, whatever it is, do it. But in anything, and for any respectful nature of anything, don't do anything in excess. That's not going to be good for you. All right, so with this, that's the end of this particular lecture. This is Chapter 2. I appreciate that you took time to spend with me for Chapter 2. We're going to go ahead and log out at this point in time, and we'll see you at the next lecture. We'll see you soon.